Now, this lovely patient presented my surgery long time ago, and we're so lost in touch together. And unfortunately, as time goes on and I move practices, she represented again, this time referred by another specialist who suggested the patient would come back and see me to be able to restore the failing dentition. Now, this is a complex case because you have a very high smile line, the teeth are failing, the existing restorations are failing, the old crowns are failing. You can see the roots are exposed and the dark crown margin is exposed, and she wants to smile. She's very conscious of her teeth, conscious of her smile, and she's a beautiful lady. In her work, she just looks after a lot of prominent people, and she's a dressmaker, so that aesthetics is very important to her. Not only to her, but at the stage in her life where she feels she needs to really do something about it. We had a frank conversation, and it was time to treat. Again, in this case, we can't just simply do quick diagnostics, but we did a lot of the work on the models that we mounted on a special thing called articulator, and I played on the model till I got everything else is right, and we were able to transfer that on the mouth and have a look how the whole thing worked. But nevertheless, we were all happy with the initial diagnostic outcome. And this is one of those treatments where you have to treat the patient, assess, and treat again, assess, and you know where you're going, but make little changes to be able to make it right. And sometimes things are not always perfectly straightforward. You need to be able to have contingency plans like plan B, plan C, plan D. So the important thing is for me and this lovely patient that we both understood each other. And when patients understand the complexity of the treatment and they give me leeway to treat them, rather than saying, I want this, doctor, you got to do this for me. And that's very hard to be able to comply because biology is chaos. It's very hard to control biology, but we do our best to treat our patients. So because I'm so enthusiastic and I'm so committed to the patient's well-being and getting the best treatment for our patient, I love what I do. The treatment plan and the treatment progress you see for this patient is quite unique. The aim was to retain as many teeth as possible. I don't take taking teeth out very lightly. And most importantly, we maintain key teeth in the mouth, especially the upper front teeth, the 6 upper front teeth and some of the back teeth on the upper arch, and also the lower front teeth we maintain as well for this patient. Then we placed implants on the important parts on the upper and lower arches. During that time, we placed temporary crowns and bridges that allowed me to assess the smile line. We also lifted the gum lift. We lifted the smile line to create natural smile lines so there's no lower gums are showing. So in other words, we reduced the amount of smile by about 5 millimeters. It went from the frame from the here when she was smiling way up there to create a good proportion of teeth, gum and lip that's showing during the dynamics of speech and smile. Once that was corrected in a temporary stage, as you can see in the slides above, then I proceeded with final tooth preparation for tooth support crowns, and once the implants were placed and they integrated the bone, this took over about 6 months to treat this patient, and we were able to put the whole thing together in like a mechanical set basically. And if you look at the before and after images of this patient, you can see how every compositional elements fit together and how it complements the face. We've made this patient look 20 years younger, and she's gorgeous, absolutely beautiful, not just at the end, but she was a beautiful patient at the beginning, except I could see where I want to go. And in that process, I also explained the patient where we should go. And this patient was most adherent to the treatment plan. She's here every 6 months religiously, and we have had perfect results for all these many years. I think this case is about 5-6 years old now, and it's been never missed an appointment. So the point I'm trying to make is when we do these complex cases, the most important thing is not what we're going to do for you or whether we'll get a good result or not. The aim is the maintenance protocol. If you cannot come for every 6 months, and for us to maintain biology and maintain our restorations for you, it's probably not going to give us a good result because you can't maintain what we've done for you. You have to commit to our practice when we're treating you so we can look after you. We can't just treat you and you just disappear and never come back. We don't see you and come back 10 years later, have failed restorations. Doctor, your restorations failed, because I'm not there to maintain you. So if you obtain a proper consent that explains you that you have to be here every 6 months so we can look after you. Okay, things can go wrong sometimes and I accept that, but we're always here to look after you. For this beautiful patient, that was part of the treatment plan. That was part of the diagnosis. Is the most important thing, or besides a correct diagnosis, is the maintenance protocol to achieve and maintain the desired aesthetic and functional outcome. We want you to look good, not the day that we finish your work. We want you to look good and feel good and function well, smile well. Also, next few years that are coming up. Things do wear out. Things can go wrong, but you need maintenance. And that's an important part of the complexity of the treatment that we provide for you. So please remember, when we decide to do all this complex work for you, the promise is that you maintain your regular checkups with us so that I can help you to preserve your smiles for as long as possible.